watching SHEM Ministries, souls honoring Elohim's mandate. And now for today's message.
Well, hello. Welcome to SHEM Ministries. That is Souls Honoring Elohim's Mandate. And tonight, this is our SHEM 2 night. That is a spiritual, healthy, enlightening mandate ministry. And I am Dr. Anna Shaw Devlin. I am a family nurse practitioner. And guess what? I love what I do. Glory be to God. I say that. I hope you really know that is not rehearsed. I hope you know how much I love teaching and educating myself as well as others about things that we all need to know. So tonight we are going to talk about why we can't eat wheat. And as I promised on last week, we were going to discuss celiac disease. And the thing that I want you to remember, if you do not remember anything else, a person who has celiac disease cannot eat wheat. And last week we talked about lactose intolerance, and I was telling you, that it wasn't easy adjusting your diet and how difficult it was to, for me myself, because I shared that with you, to find foods that I could enjoy without the dairy. Well, guess what? When we finished talking about not being able to eat wheat, this is an autoimmune disorder. This is not a gradual, progressive thing and you just, find alternative. There is no alternative. You cannot eat wheat. And that's what we're going to talk about tonight. Celiac disease. And if you yourself don't know of someone that has celiac or high risk or may have celiac, I know that this lecture is intended for the good. And I know that those of you who view may come across someone to share this with, okay? So at this time, let's have a word of prayer. Dear Heavenly Father, we thank you, we praise you, and we glorify you for giving us another day. Thank you, Lord, how we slept during the night and awakened fresh and new, ready for a new day, a day that we dedicate to you, Lord, because you didn't have to do it. You did not have to wake us up, but you did. So how can we not give that day to you? We take it for granted, make it all about us, but it's not about us, Lord. It's about us being the willing vessel that you need throughout the day to speak life, show love, let people know that they do matter in this world. So we thank you for that. And Lord, we ask that you just bless us to make this plain. Bless us to bless others. In Jesus' name we pray. Amen. All right. So, we're talking about celiac disease. And first of all, let's see. I created some slides, of course, and I really wish I could number my slides. Uh, let's see. Let's see. Um, nope, that's not the right one. So sorry. Okay. Wait a minute. Here we go. Yep, there we go. Not that one. Okay. All right. So, because I wanted you to be able to read some things and take notes. So, I've been trying to do better with creating some slides versus just hearing me. But you're always welcome to go back and listen again. But celiac disease is an illness caused by an immune reaction to eating gluten. Gluten is a protein found in foods containing wheat, barley, or rye. Oh my gosh. If you had to, they've actually fixed it now where they have a section in the grocery store that says gluten-free. Because I'm going to tell you, can you imagine having to read all the ingredients on everything you ate to figure out if it contained wheat or a form of wheat? Okay? If you have celiac disease, and I'm gonna go through some foods and things, because I've got a list of foods that you would be surprised that if you had to go through and try to figure out what I can and can't do. And I've got a list of them broken down, and in a minute I'm going to go through and say, that there's basic foods allowed in a gluten-free diet, and then there are grains and starches that you can have. But there's a lot that you can't have, and I'm going to read those as well, because I think that everyone knows, Anyway, now that there's really not much to teach you about what celiac disease is. It is, you cannot have gluten, point blank. So there's really nothing to explain other than to tell you what you can and can't have, and testing and things such as that, and symptoms. Okay. So we're going to talk about the logistics, and then we'll talk about the food stuff, because to me, that is the most challenging thing. And also the fact that, being that this is hereditary, can you imagine children trying to find something for your kids to eat that they would be healthy and grow up, not deficient, and it how children are. They're finicky eaters anyway. So this is an autoimmune disorder that many times is detected in children. So, but gluten is the protein found in foods that contain wheat, barley, or rye. If you have celiac disease, eating gluten triggers an immune response to the gluten protein in your small intestine. Over time, this reaction damages your small intestine's lining and prevents it from absorbing nutrients, a condition called malabsorption. Wow. I do have a picture, because I want to show you in celiac disease. Let me get rid of, wait a minute, we'll go back to this one. But in celiac disease, I want you to see the difference between a normal gut, the lining, see the rugae, the nice little villa. These are, I don't, the best analogy that I can say is kind of like falling in a hole. Nutrients fall in the hole so that they can be absorbed, right? The little appendages sticking out. That's in a typical normal gut. But when you have celiac disease, over time, all this battling and the fighting, like we talked about with the microbiomes and everything, and we talked about, inflammation and things, this immune response damages the lining of the small intestine. And you see the difference between the two? And you're no longer able to absorb anything. There's no hole to fall into and get gobbled up or eaten up. Okay? So, the intestinal damage often causes symptoms such as diarrhea, fatigue, weight loss, bloating, or anemia. It also can lead to serious complications if it is not managed or treated. In children, the malabsorption can affect growth and development, in addition to gastrointestinal symptoms. And there is no definite cure for celiac disease. But for most people, following a strict, when I say strict, a strict gluten-free diet can help manage the symptoms and help the intestines heal. Oh my goodness. So let me show you this, okay? First of all, I chose some pictures of different vitamins. So the small intestine, this is why, and if you see in this picture here, vitamin B6, you see the whole grain cereals, this is where we get a lot of the B6 from. And it's for proper metabolism of amino acids, disease resistance, and anti-emetic. That's not being nauseous. And deficiency leads to anemia, poor resistance against diseases, and atrophic, which is shriveling up, where things atrophy and they die. Lymph tissue. And that is our lymphatic system for our immunity. So if you had to eliminate the whole grains in your diet, the good thing about it is this. Here's other sources that you would have to know what you can eat to get your B6 vitamin. So that was the reason I put that video. I put this slide in here because these are other, so a person does have alternatives. They just have to be really, really, really strict on what they do. And then here's another. This is another vitamin B. And you see the whole grain cereals, but there's the potatoes and tomatoes and things. But the sad thing about it is, what if a person has, and I'm going to read to you or tell you that a person with celiac disease can damage the small intestine to the point where they end up with lactose intolerance as well. Remember last week when we talked about the small intestine and producing lactose? The lactate enzyme, right? Lactase enzyme. That comes from the small intestine. So both of these disorders are linked to the small intestine. So the damage can end up with lactose intolerance. So in regards to the B6 that I showed you, I think you probably saw that there was dairy on there, so there was milk. So if the person can't eat neither one, they're in trouble. So there's definitely malabsorption and a lot of difficulty with maintaining weight and not being anemic, this, that, and the other. Now here is another one. And this is vitamin B1, okay? And it is definitely necessary for growth, appetite, normal intestinal function, nerve and muscle function. Deficiency can lead to the weight loss, no appetite, innervation, defective carb metabolism. So you know, I just want you to, as we talk about the different foods, I want you to understand that not being able to eat gluten is major for so many people. Have you ever gone in the grocery store and said, wow, they got a whole little section over here saying gluten-free? Well, when we get finished today or this evening, you'll understand why there is a section that says gluten-free, okay? So, as I mentioned, I said since we had already started talking about nutrition and diet, I want to go through and tell you some things about celiac disease in regards to treatment and diet. So a strict, lifelong gluten-free diet is the only way to manage celiac disease. Besides wheat, foods that contain gluten include, okay, so gluten we know is in wheat, but gluten is also in barley. Now, I don't know what bulgur is, B-U-L-G-U-R. Durum, we know that's a form of wheat. We've seen that on many things. Farina, F-A-R-I-N-A, I've seen that on some wheat products or whatever. It's like high in this, gives you that, okay? These are other alternatives that, because you know, people don't get the wheat that is necessary in their diet. It's healthy. And let me see what's going on with this light here. Oh, okay. I don't know. I had a little yellow light. So they were recommending eat more rye, eat more this, that, and the other instead of eating wheat. But if the things that they're telling you to eat are gluten, have gluten in them, then you're in trouble. So there's gram flour, malt. Oh my gosh. You mean like barley and malt and beer? Ooh, you can't drink beer. What? Oh, okay. Well, there's semolina, spelt, which S-P-E-L-T is a form of wheat. I've never heard of it, but that's on the list. It's funny how until you have a disorder or you really learn in a hurry, you know, what's what is considered what, like whey. I didn't know whey was dairy, okay? Never thought about it until I learned that I had to avoid it. And then there's something called triticale, T-R-I-T-I-C-A-L-E. That is gluten, a gluten product. Now, a dietitian who works with people with celiac disease can help them plan a healthy gluten-free diet. They can go through and say, Well, because the thing about it is this: there are people who have had gluten or celiac and didn't know they had it, and then eventually, when they had the symptoms and side effects of the disease, that's when they identified it. Okay. And by that time, they were able to say, I like this, I like that. Okay. But a dietitian can help them decide what will be good for them. Even trace amounts of gluten in your diet can be damaging, even if they don't cause symptoms. Oh, can you imagine? Gluten can be hidden in foods, medicines, and non-food products, including there are modified food starch, preservatives, and food stabilizers. Like food on the shelf, they put it in there to keep them, the shelf life, and you don't even know. Prescription and over-the-counter medications, vitamin and mineral supplements, herbal and nutritional supplements, lipstick products, toothpaste and mouthwash, communion wafers. That's right. Envelopes and stamp glue can have gluten in them. Play-Doh. Oh my gosh. Children love Play-Doh. Just don't put it in your mouth. And certain makeup products. These are things that I never would have thought that would have contained gluten, and that a person with celiac disease would need, because you absorb it. You lick the stamp. You never would have thought of it. So removing gluten from your diet will typically reduce the inflammation in the small intestine, causing the person to feel better, and eventually they can heal. Children tend to heal more quickly than adults. Of course, makes sense. Okay. Here are some other things to look out for. First of all, you definitely have to learn to read labels. Avoid packaged foods unless they're labeled as gluten-free or have no gluten-containing ingredients, including emulsifiers and stabilizers that can contain gluten. In addition to cereals, pastas, and baked goods. Other packaged foods that can contain gluten include, of course, I said beers, lagers, ales, and malt vinegars. I forgot about the malt vinegar. Candies, gravies, imitation meats or seafood, processed luncheon meats, rice mixes, salad dressings and sauces, including soy sauce. Oh no. Seasoned snack foods such as tortilla and potato chips. Self-basting poultry and soups. Now, pure oats, believe it or not, aren't harmful for most people with celiac disease. But oats can be contaminated by wheat during growing and processing. That is amazing. Now, let me say this to you, because I found somewhere, I was reading that when stuff is labeled, remember when I was saying about lactose, and I was saying sometimes there's things that's labeled lactose free, and it can have a certain amount of lactose in it, and you not even know it, right? I'm trying to find it, but I read last night that there is oh gosh, it was on I think this is it, National Institute of Health, where it said that there's a certain percentage of gluten that can be in something, and they still say that it's gluten free. And I thought I had printed it out, but I think it was like 20 something, 20 whatever the units of measurement that they use. I am so sorry, I thought I had it, but they can have 20 of that and it still say gluten free. I am okay, sorry about that, but do know that for a person who has very severe symptoms, they have to be extremely careful. Now, we're mentioning symptoms, so let's talk about symptoms. And I want to talk about complications as well. So, the intestinal damage often causes symptoms such as diarrhea, fatigue, weight loss, bloating, or anemia. It also can lead to serious complications if it's not managed or treated. And that's what we were saying before. The digestive symptoms can be different for children and adults. The adults include diarrhea, fatigue, weight loss, bloating, gas, abdominal pain, nausea, vomiting, constipation. Now, the first thing I thought of when I read through this was, that sounds like lactose intolerance. That sounds like any GI disorder. Crohn's, irritable bowel, right? That's the reason why. And let me say this. If you ever present to a doctor's office or an emergency room with a complaint of GI symptoms, right? Especially abdominal pain, you are going to get a workup. There is too many things that could be wrong. Too many things. You're going to get labs done. You'll probably get a CT of the abdomen. There is just too many things that have to be looked at. So I'm just trying to prepare you. And don't make a statement, they just want my money. No. We have talked enough about GI lately. It ain't about the money. It is missing a diagnosis. It is, you need electrolytes to make your heart beat. And if absorption and malabsorption are reliant on your GI system, GI tract, oh, no. That's one workup, don't ignore, okay? Cardiac, don't ignore. Your gut can cause so many other organ damage and issues and problems. It's not worth ignoring. I just had to say that. However, more than half the adults with celiac disease have symptoms that are not related to the digestive system. And they include anemia, usually from iron deficiency due to decreased iron absorption, loss of bone density called osteoporosis, or softening of the bones called osteomalacia, itchy, blistery skin rash called dermatitis herpetiformis. And guess what? That is part of our, I have a picture of that, and that is something that we are going to discuss a little bit more in detail once we finish going through these symptoms. Now, vitamin deficiencies, mouth ulcers, listen, I'm telling you, headaches and fatigue, nervous system injury. If we only knew how important what we eat is until we lose the ability to eat something, you don't realize the detriment on you when you're malnourished. Numbness and tingling in the feet and hands, possible problems with your balance and cognitive impairment, iron deficiency, B12 deficiency. There's so many vitamin deficiencies from malabsorption here. Joint pain, reduced functioning of the spleen, known as hyposplenism. Now, your spleen, I tell people it's kind of like the trash can. It gets rid of all the dead tissues, and when red blood cells die, they go to the spleen, and get thrown out in the trash. So anyway, if the spleen doesn't work, then you're going to have a buildup of other things in your body that will cause discomfort and pain and so many things, okay? Elevated liver enzymes, so many things. Children, let's talk about children. Now, and the reason I definitely want to talk about children, because the earlier a diagnosis is made and you find out, or that person finds out, that they need to go on a strict gluten diet, the less damage is done and their body can heal. So ideally, this should be diagnosed in children. So we need to watch children closely. Children have a tummy ache. Well, you ate too much candy. You shouldn't have eaten all that candy. I mean, we ignore children sometimes. We don't pay attention to the little subtle things, but we need to. Children with celiac disease are more likely than adults to have digestive problems. Nausea, vomiting, chronic diarrhea, a swollen belly. Now, children normally, proportionately, because of being a baby, have a little tummy, right? But I'm talking swollen, not soft. I'm talking firm, taut, okay? There's a difference. There is, you touch it and they flinch. Rebound tenderness. You touch them and let go and they delay in their response. Like you can press and it doesn't hurt, but when you let go, they holler. That's rebound tenderness. Got it? Okay. Children have constipation, gas, pale, foul-smelling stools. You remember when we talked about the bowel movements? And let's see, what's wrong with this thing? When we were talking about bowel movements, and I said to you that, if you have pale stool, something ain't right. We talked about bile and from the gallbladder and blockages and things that would change the color of your stool. So it's not normal for a child to have a pale, foul-smelling stool. Neither adults, but noted more in children. The inability to absorb nutrients might result in Failure to thrive for infants. Now, what does that mean? That means children who aren't growing. Like, wait a minute, you're supposed to be X amount of inches by now, or 2 feet tall, or something. And you're supposed to weigh a certain amount by now, but you don't. That's a red flag. Damage to the tooth enamel. Whoa. Yes, your children need to go to the dentist, and anyway, sometimes they'll blame it on eating all that candy. Don't let them children have all that candy. It's dentists, especially pediatric dentists, are trained now to the warning signs. But that is one sign. Weight loss, of course, the anemia, irritability, and short stature is what we talked about. Now, let me say this. If mama and daddy both short and the child is short, okay. All right. There is a medical terminology called FLK, funny looking kid. That is a medical legal diagnosis. The child looks funny. But we were taught that before you make that diagnosis, look at your mama and look at your daddy. Now, if mom and daddy both look funny and the child look funny, then it's not a funny looking kid. You cannot use that. And the reason funny looking kid is a diagnosis is until you identify maybe a genetic disorder, you label it as a funny looking kid until you can get some testing done, DNA testing or genetic testing, okay, for some chromosomal abnormalities. Now, the other one thing is delayed puberty. In a female or a male. So the sex hormones are supposed to develop the genitalia, and they haven't by a certain age. Something ain't right. Okay. Neurological symptoms, including attention deficit hyperactivity disorder, ADHD, learning disabilities, headaches, lack of muscle coordination, and seizures, possibilities. And these are because of malabsorption and vitamin deficiencies from the small intestine not being able to absorb, damage to the small intestine, to where it cannot absorb properly. Now, I said I was going to talk to you about dermatitis herpetiformis, and I'm going to tell you the reason I'm going to talk to you about this. And I actually created a slide, but first of all, let me show you a picture of this, okay? This is dermatitis herpetiformis, okay? Now, let me explain to you, and then I have I can just read what's on the other slide versus me trying to explain it. Dermatitis herpetiformis, or DH, is a chronic. What is chronic? Something that is present and been there for a long time, more than 3 months, okay? It is a chronic, intensely itchy. Oh my goodness, a mosquito bite drives me crazy. I could not imagine having a chronic, intensely itchy, and it's blistering skin manifestation of celiac disease. DH is a rash that affects about 10% of people with celiac disease. So guess what? Can you imagine this rash showing up, and then they get a diagnosis of celiac disease based on the rash, and then come to find out that they've been suffering with this illness for years? DH is found mainly in adults and is more common in men and people of Northern European descent. It is rarely found in African Americans and Asian Americans, okay? The symptoms are characterized by small, clustered papules and vesicles. So these are, remember the little chicken pox type blister things, the bubbles up under the skin? Those are vesicles. They erupt symmetrically on the elbows, knees, the buttocks, back, or scalp. The face and the groin can also be involved. A burning sensation may precede the lesion formation. Now, if it wasn't for the actual location, I would think, oh, maybe chicken pox in a child. Or I would think maybe they had shingles or something, which is what? Chicken pox in an adult, okay? Lesions are usually scratched off by the time a person would go in to get examined, and the rash may appear as erosions and excoriations. So if you look at the elbows, those are areas in which the rash itself has been already scratched, okay, and excoriated. So, what causes this? Dermatitis herpetiformis is caused by the deposit of immunoglobulin A, IgA, in the skin. And this is what triggers further immunological reactions resulting in lesion formation. What are you talking about, Dr. Devlin? Okay, now let's go backwards. How do we diagnose celiac disease? Okay, I am going to show you, where's my slide? All right, there we go. Diagnosis is made with blood tests, biopsies of the small intestine, skin biopsies, and genetic tests. That's why I was saying, person shows up with this rash, these lesions, and they might say, wait a minute, we let's do some testing, right? They may start with blood and then end up doing biopsies. Well, I do have a slide where, here we go. Yep. Auto antibodies for the detection of celiac disease. So remember when we talked about our immune system, and most people who, we endured the COVID, and we found out that there were auto antibodies. Whenever a virus enters into the body makes antibodies to it. Well, that happens with celiac disease. And they can do what's called, they do celiac disease antibody tests. Okay? These tests are primarily used to help diagnose and monitor the disease itself in people that present with signs and symptoms, including anemia and abdominal pain. Sometimes celiac testing may be used to screen people who are asymptomatic, who have close relatives with the disease. Like I told you, it runs in families. So if, for example, you want to know, it runs in your family, and you want to know if you have it or at risk of passing disease down to your children, they can screen you for it. Okay? There are about 4 to 12% of people that have or will develop celiac disease in your family. So if you have celiac disease, 4 to 12% of your family members may develop the disease or will have it. Okay? And of course, I'm not going to get into it, but there's other autoimmune disorders that are linked to celiac. But the main one, and you'll see this, the main one is, I've got it up here for you. It's called tissue transglutaminase antibody. It's TTG-IgA. And the reason I put that up there, IgA, TTG, IgA antibody. The reason that is up there is because you need to know that if they're going to test you for celiac disease, make sure they test you for this one in particular, this antibody, because it is the most sensitive and specific blood test. It is the single test preferred by the American College of Gastroenterology, the American Gastroenterology Association, for the detection of celiac disease in those over the age of 2. So when in doubt, right, get an antibody test done, and the antibody test that should be done is the tissue transglutamase antibody. It's usually seen as a little t, big G, and it is an IgA immunoglobulin A test. Now, I know that's a lot, but the main thing I wanted you to get from this is that gluten, which is in wheat and barley, and can be in many things that we don't even realize until we have to eliminate it from our diet, is the diagnosis can be made with a simple antibody test, or it can be confirmed. It can be suspected but confirmed. And like I said, 10% of people with celiac disease have this dermatitis herpetiformis rash. 10%. So, the other thing, I think I was going to tell you a little bit more about children, though. If your child is pale in color, now if you're African American or you are black or brown, as we say, in order to tell if your child is pale, look at the mucous membranes in their mouth. You look at their gums. Are the gums pale, dusky, gray looking? You can look in the conjunctiva of the eyes. Pull the eyelid down or look and see. Is it pink up under there, or is it pale looking? You can even look in the eyes themselves and see they're not shiny and white. But now if this is how they've been your whole life, now that's a different story. But the mouth, the nail beds, look at the nail beds. Are they blue looking, dusky gray looking? That's how you determine paleness in a person of black or brown color or descent. That can be many different races these days. So we can't just say African American, okay, or Hispanic or whatever. But if they're pale, like really, really irritable, like all the time irritable, never happy, and it's not an emotional thing with attachment, issues or things such as that. Your child is failing to grow, has a pot belly, okay? Now when a child has a pot belly. Okay, first let me say this, and maybe this will give you a good picture. And let me put myself back up. I'm sorry. We'll get rid of that. You know how we would watch those not videos, but the children starving in Africa. Remember that? And you would see these kids and like, how are they starving? They got this big old pot belly and they got these little arms and little legs. They are suffering with malnutrition. Okay? But the reason for the malnutrition in a person with celiac, okay, so they're suffering from malnutrition because they're starving. They have no food. So that's why they have a pot belly. But the children with celiac disease are suffering with malnutrition, but it's because they cannot digest gluten. Their body has an autoimmune reaction to the gluten. And there's a warfare going on in the colon. Okay? But they end up with a pot belly too. Okay? Their malnutrition is not from the fact that they're starving and have nothing to eat. But could you imagine starving and having a gluten intolerance? Because what do they send? Do they not send some type of wheat or to make bread or to rice or something, right? Okay. And I already told you about the foul smell and bulky stools. Let me see what else I wanted to tell you. Celiac disease, of course, I said runs in families. If someone in your family has a condition, it's worth being tested. And guess what? One of the risk factors for having celiac disease is type 1 diabetes. I'm telling you, the more we learn, and let me tell you some other diseases that are associated. Hold on, let me see, wait a minute. I'll make sure I didn't leave anything out. Okay. Sometimes celiac disease becomes active after surgery, pregnancy, childbirth, viral infection, or severe emotional stress. Like a trigger. Like the genetic predisposition was there, but something triggered it. When the body's immune system overreacts to gluten in food, the reaction damages, like I said, the tiny hair-like projections called villi that line the small intestines. And that was that picture I showed you. Yep. Celiac disease tends to be more common in people who have a family member with that disease or the dermatitis herpetiformis that I told you about. I told you about type 1 diabetes, Down syndrome. Williams syndrome, or Turner syndrome. Now, I don't have time to teach you, but most people know Down syndrome and Turner syndrome. These are the funny looking kids, okay? Autoimmune thyroid disease, microscopic colitis, anything inflammation in the colon, and Addison's disease. Wow. I already told you that it can lead to malnutrition, bone weakening. I'm just trying to make sure. Infertility and miscarriage. Malabsorption, that's right, of the calcium and vitamin D can contribute to reproductive issues. The lactose intolerance I mentioned to you about, damage to your small intestine, might cause you abdominal pain and diarrhea after eating or drinking dairy products that contain lactose. Once your intestine has healed, though, you might be able to tolerate dairy products again. So the lactose intolerance is transient, like when I was telling you, if you get a gastrointestinal infection and you develop lactose intolerance for a short period of time. Cancer. People with celiac disease who don't maintain a gluten-free diet have a greater risk of developing several forms of cancer, including intestinal lymphoma and small bowel cancer. Not the large intestine, where most people develop colon cancer from the polyps in their large intestine. We're talking about small bowel cancer. And we already talked about the nervous system condition with celiac disease. They can develop seizures, or they can develop the peripheral neuropathy that many diabetics get. So if a person has nerve damage and they're not diabetic, and they're not a smoker, they don't have vascular disease, they be worth testing them, doing antibody testing. Okay? I think pretty much it takes, in rare instances, the intestinal injury of celiac disease doesn't respond to a strict gluten-free diet. This is known as refractory celiac disease. If a person still has symptoms after following a gluten-free diet for 6 months to a year, you should definitely go see a gastroenterologist. I don't know if I would wait 6 months or a year. If you see that dermatitis, herpetiformis, rash come on you, time to go. Time to go. Okay? I'm looking to see if there is anything else, but I wanted to share with you. We already talked about the dental enamel. We talked about, let's see. Let's talk about family, because I didn't tell you the percentage, okay? So family studies have been done, and it showed that 5% of first-degree relatives of a person with dermatitis herpetiformis. See, I think I talked more about the dermatitis herpetiformis more than I did celiac, because you need to understand the link between that rash and what's going on in your body that you may not even realize until you get sick. Like sick, okay? But 5% of first degree relatives of a person with DH will also have DH. An additional 5% of first degree relatives of a person with DH will have celiac disease. It's almost like they go hand in hand. How about the most common autoimmune disease associated with dermatitis herpetiformis is hypothyroidism. And that is the autoimmune thyroid. Let me say this. Diagnosis. A skin biopsy is the first step in diagnosing DH. And it will show lesions that have granular IgA deposits. Because remember what I told you, it is the IgA deposits in the skin that are causing the severe itching, and it will show up. Histology of lesional skin may show neutrophil and eosinophil. So these are white blood cells that the white blood cells, remember, that's the army that's going to fight for you, right? That's part of your immune system. And so there's different types of white blood cells, and the neutrophils and eosinophils are the main ones. I know this is maybe a little extra information, but trust me, you can go back and listen to it again. And remember what I told you, that when you talk to your doctor and oh yeah, I've heard about that. Oh, yeah, you did, didn't you? I understand, doc. I got it. Right? And all that getting understanding. But there is treatment though. And it's called sulfone-dapsone. And many of these treatments, for patients who cannot tolerate the dapsone, sulfapyridine or sulfamethoxypyridazide may be used. These are medications that are less effective. Just know that there is treatment, and the treatment is called dapsone. Okay? I hope I blessed you in some kind of way. I just could not talk about lactose intolerance and not talk about celiac disease, because celiac disease is something that many people don't know much about and don't associate celiac disease with gluten and wheat. And understanding why you can't eat wheat, why they can't eat wheat, and why there is a section in the grocery store specific for gluten intolerance. And you will see in restaurants now that they are now offering meals or gluten-free, like pizza dough and things such as that. They're you can purchase the cauliflower. They learned, why do you think that? Yeah. Who decided that we need something other than pizza dough for pizza? People who can't eat the pizza dough. Okay? All right. Well, thank you for tuning in tonight. We will continue to strive to allow God to feed his people what they need. But I also request that you tell me something that you feel that you need, that we definitely can discuss. It's actually getting hotter now, and we haven't talked about skin cancer in a while, so that may be something that we need to bring up. All right, well, God bless each and every one. I thank you so much for joining me. I am Dr. Anna Shaw Devlin, and you have a blessed night. And prayfully, we will see you on Sunday. All right. Adios, amigos. Thank you for watching.